Chapter 10 Primary Care. The National Health Service. The National Health Service is responsible for health care for everyone in the United Kingdom, although a small number chose to pay for private care. Treatment is free, but there is a prescription charge for shocks and appliances, such as a cervical coil, with a section for some patients, such as children and the elderly. Primary care is provided by general practitioners or GPs, sonatis known as family doctor, nurses, these pharmacists and apothecians. GPs work in practice for in practice of one on in practice of unto 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 20 practice a base in a surgery and look after the health of from 1,000 to 15,000 people in their local community. Deal also uh, provide health education in areas such as self as as smoking at day at day at day through clinics um, and die and die through clinics. His vaccination, for example, for influenza and may perform minor surgery such as removal of warts and molds. If a patient needs a specialist care, the GP will need a refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Uh, home home visits are made when patients are housed both unable to leave their homes or too ill to attend surgery. Out of um, over over treatment from 6 p and to eat a improvised by the local um, primarily care trunks, which organize and chief of GPs and locums GPs to cover if someone is absent. Um, uh, Note: the note surgery has trained meaning. The bulletin word GP's word the practice has moved to any surgery on the high street, a time when GP's inspection morning surgery is from 8.0 to 12.0. The work of surgeons, you the patient needs urgent surgery on a blunt appendix. V. The prostating. The prostate. The prostating. A typical GP prostating employing receptionists. They are responsible for initially initial a patient contacts and making a payment and taking requests for repeats and prescription, taking meds um, from patient and the other healthcare providers and for filling and scanning document into record. The practice manager has responsibility for finance and sometimes for it. Supervises recession staff. His, his locums and health prepares the practice, developments plan. Practice nurse run asthma, diabetes, and cardiovascular disease clinic as well as one-to-one clinic for those who wish to give up smoking. In addition to practice staff, GPs work with a number of well professionals. District, district nurses be temporarily hold bone patients such as recently discharged hospital patients to chance and dressings such as ulcer dresses. Help visit families to carry out check-ups on young children and particularly undefined to make sure they are healthy. Special attention is paid to families in name, such as those living in poverty. They also do, do baby immunization. Um, midwives run clinics for antenatal patients. Physiotherapists Physiotherapists provide hands-on training, but also teach patients exercise they can do to improve their condition, often an accident or operation. C. A GP day. Dr. Stewart worked in a practice in a small market town with three other family doctors. The surgery is in the center of the time the eats child by three practice. The, this is a typical working morning when she is not the duty doctor responsible for emergency and urgent problems. 10.1 Complete the sentence. Children over 60, 60 and people with some chronic disease do not have to patient respondation charge in the United Kingdom. 2. Patient with, patient with mobility problem may be unable to walk out. They are housebound. 3. The parent the parish GP appointment is 10 minutes long. 4. Allow GPs in someone who takes the place for a task member who is on leave. 5. Care, care out side working hours is now as out of hours trauma and trauma. 10.2 may work combination using a word of process from age, but one word can be used twice and change dressings, make appointments, make home visits, perform minor surgery, refer a patient, run a clinic, supervise staff, take message. 10.3 with men we member of a practice team and a practice team would be responsible for each of the following. 1. Running a clinic for program women meets whites. 2. Teaching a patient how to strengthen his broken limb physiotherapist. 3. Learning the GP now that a patient can come to her appointment receptionist. 4. Running a clinic for people uh, who, who want to learn weight practice nurse. 5. Visiting a patient who has just returned home after after a hernia operation. District nurses carrying carrying out check ups on children in up chin outport. enable neighborhood health visitors, organizing cover for an absurd doctor practice manager. Um, um, 10.4 complete the diary for Dr. Stewart after room. One out, one out to being practice, thing mirroring over sandwich long to add 4 p.m. afternoon surgery 12 10 minutes appointment for at for to anti for 20 p.m. comfy week for 20 at 5 p.m. check with reception for message deal with home visits and repeat recreation recruits 5 at 6 p.m. Paperwork and referrals to secondary care admin tasks. Telephone calls to patient provide medical examination seats PM for funds squished to out of hours service.